Hello everyone, and welcome back to part 2 of the 40 symptoms that should warrant a call to your acupuncturist. Now, we've received so many private chat requests yesterday and emails and phone calls with regard to the symptoms discussed yesterday. And many individuals, and we've even gotten 3 callers from Japan, which was quite interesting. Many individuals, and 2 of those callers from Japan were American, and 1 was British. And they'd even expressed that they didn't know acupuncture can help a person with swollen legs, feet, or ankles, and another one didn't know that acupuncture can help with skipping heartbeats, which they found interesting. And this is why I say over and over in many podcasts that you'd be surprised as to how much you can benefit from acupuncture. This is why I'm constantly saying follow Acupuncture is My Life on every social media platform under Acupuncture is My Life, or if you're a Twitter person, it's Acu_is_my_life. And more people are beginning to watch the YouTube channel under Acupuncture is My Life, and are becoming more and more surprised as to how they can benefit from acupuncture, and some are recommending loved ones and friends and co-workers and so forth and so on. And we're getting a lot of feedback, and this is why I constantly recommend you download the Acupuncture is My Life app from the Google Play Store, because there's so much that you can learn in private chat sessions. But people are surprised that 20 of these 40 symptoms that they heard yesterday, they had no clue that acupuncture can help them with these problems. And some thought about going to see their doctor and couldn't get appointments, especially at a time such as this. So they would just ignore it and just, let it pass, or look for some type of over-the-counter remedy, which is extremely dangerous. You just shouldn't do. It's good to have your problem diagnosed, whether it be by an acupuncturist or your doctor. And some have access to a local acupuncturist, but simply thought acupuncture was just for pain. And I state over and over, there's so many disorders that acupuncture can treat. I've even recently had a lupus patient and a Parkinson's patient assigned to me at the Acupuncture is My Life clinic here in New York City, and am anxious to start those cases. I've dealt with multiple sclerosis in the past, cancer patients, adjunct to chemotherapy, radiation therapy. It's Raynaud's disorder. Acupuncture can do so much for you. And this, again, follow Acupuncture is My Life on every social media platform. There's so much that you can learn. So much. But to continue, as part 2 with the 40 symptoms that should warrant you to call your acupuncturist. Another one is if you have lower right back pain. Now, along with seeing an acupuncturist, I'd recommend that you see a nephrologist to rule out, get blood work up, urinalysis, to rule out any damage to your kidney. But a lot of times it can be as a result of, a pulled muscle. And this is why I say lots of acupuncturists work together with doctors of all specialties, to treat ailments. So it's good that you become aware of that, because also a case such as lower right back pain could be as a result of appendicitis. Now, a doctor may treat the symptoms, but again, an acupuncturist would diagnose the root cause of it and look to treat the root cause so that you may never experience that problem again. And that's important, because so many people see acupuncture as totally being separate from allopathic, or should I say Western medicine. And that's not the case. They work well together as well as separately. Another situation or symptom is if you think you have the flu. And at a time such as this, whereas we have COVID, you should get tested. You should get tested. But an acupuncturist can see that as a Taiyang syndrome and address it accordingly. Because we specialize in treating external pathogens, and there are different approaches that we can take to treating external pathogens. That's why I'd say, some of the things that I may bring up here while discussing the 40 symptoms that should warrant a call to your acupuncturist or even your doctor. Nothing's absolute. Nothing is absolute. Another is vomiting for more than a day. There's a myriad of reasons, such as foodborne or viral illnesses, which can be tie-in syndrome. There's many ways to deal with this, but it's good to go see your doctor, because you can quickly become dehydrated as a result of this. And it's great to see your acupuncturist as well, because how has the Sanjiao meridian, which covers water flow, water metabolism in all three sections of the body, whether it's the upper jiao, middle jiao, or lower jiao. Sanjiao means three, and san is three in Chinese. The three areas of the body. And as a result of actually vomiting for more than a day, how have you become dehydrated? How has the Sanjiao meridian, the spleen meridian, been affected as a result of it? Any meridian within the body. So it's important to see an acupuncturist to address any deficiency that's going on. It's the same with diarrhea. There's so many syndromes that can be tied to diarrhea, like Shaoyin syndrome, Tai-Yin syndrome. There are many ways in which an acupuncturist can diagnose the cause of your ailment or your disorder. And this is why it's important to sit with an acupuncturist. And a lot of times, we'll contact your doctor. We may request blood workup or different tests to be done, and sit with you and discuss it and look to move forward. Another is you haven't urinated in 6 hours or longer. Now this can be a sign of dehydration or even kidney failure. And you may want to see a doctor or your nephrologist as well as your acupuncturist, because this is cause for concern. On average, you should urinate around 6 times a day. And depending on your age, let's say you're older than 50, to wake up one time in the evening to use the bathroom is okay. But if you're constantly doing that, let's say when you're younger than 30, there can be a problem as well. But in this case, if you haven't urinated in 6 hours or longer, that's cause for concern. Another is if your pulse is just like rapid, beating so fast, but you don't know why. Could it be a sign of anxiety or some form of heart rhythm abnormality? Your acupuncturist. Because this could be a Yang Ming disorder. This can be as a result of you becoming infected with some type of external heat pathogen. We can go all over the spectrum with it, but there's many ways in which an acupuncturist can get to the bottom of it, as well as, let's say, a doctor or a cardiologist. And also another is, what if it's painful to swallow? You're having trouble swallowing. And that could just be, let's say, the normal spittle that, your mouth creates, that you're unconscious of, it creates and you swallow periodically. That can be a problem as well. You sit with your acupuncturist, doctor. Another is your cold. Just a simple common cold could have gotten so bad that you're struggling to breathe. What type of lung disorder? How is the lung meridian in acupuncture been affected? This could be a sign of pneumonia. How do we approach treating this external pathogen? What type of herbal formula do we put you on that's customized to the pathogen in which has infected you, as well as your constitution? How do you respond to it? Because everyone's different. We're all unique in our own way. So what works for one may not work for the other. So there's no one size fits all theory in acupuncture. Another is if it hurts when you urinate. Urinary tract infection. Go see your urologist, your gynecologist, your acupuncturist. Another is severe abdominal pain. There's a slew of reasons that can cause this, from obstruction of your bowels to appendicitis, gallstones, diverticulitis, hernias. Acupuncturists can treat these problems as well as your doctor. Another is mental. From a mental angle, is you have weird mood swings, which can be, of course, tied to a mental disorder or a stroke or undiagnosed diabetes. Now, that's a surprise to a lot of individuals. Undiagnosed diabetes can cause weird mood swings. It can affect your mood. Another is what can be called a thunderclap headache, where it can be the result of bleeding in the brain, of the brain. See your doctor immediately. Don't look for anything to remedy it as far as painkillers or anything over the counter. See your doctor as soon as possible. Once diagnosed and some form of therapy is recommended, go see your acupuncturist right away. Another is all of a sudden you just pass out. It can be as a result of hypoglycemia, which is low blood sugar or low blood pressure, seizure, heart issues, dehydration. Again, in a case such as that, you'd sit with your doctor as well as finding an acupuncturist. And if you can't find one, again, I'll say it again, contact Acupuncturist, my life. We're here to help you. No matter where you are on this planet, you can reach us. We're here to help you. And if we can't, we'd always look to make recommendations. Another is you begin to have trouble seeing out of one eye. One is normal and the other one is a bit off. You're having problems. This can be a sign of migraine, stroke, optic vessels being blocked, blood vessels being blocked, a myriad of things. Again, you see a doctor. It's a migraine. Acupuncture is great, not just for migraines, but for treating post-stroke, eye problems. Another is blood in your urine, which again can be a sign of kidney issues or urinary tract infection. These things you cannot take for granted or just feel, oh, it just happened this one time, I'm going to ignore it. It'll pass. This is your health. Addressing these issues should be a clear reflection of how much you care about yourself. Because again, I'll say it over and over, health is wealth. How much do you really care about yourself to address these problems head on as soon as it happens? Because our bodies always give off signals. Something is wrong, and if you don't address it, it will more than likely get worse. Now, a lot of times our bodies can heal itself, but I'm not telling you to look at it in that light. It's best to be sure than unsure. Because you don't want a simple issue metastasizing into something even bigger. Because if you even sit with an acupuncturist, we diagnose you. It's our responsibility as well as if you need to see a doctor, an allopathic doctor, to address the issue as well. We have to inform you of that. Again, this is why I say it's not either one or the other. Because in some cases, as a tandem, it works well together. Now, another symptom is experiencing wheezing sensations, which can be asthma or an allergic reaction to something. There's ways in which an acupuncturist can find out what's wrong and address it. And if it's necessary that you see your doctor, strongly recommend it. Another is your skin turning yellow. If you notice your complexion, your skin is turning yellow, okay, could it be hepatitis? Could it be due to gallstones? Turning yellow is a bad thing. It's not something like, oh, I'll give it a couple of days and, this will pass. Again, acupuncture treats these symptoms. All of the symptoms I discussed, acupuncture can treat. And if it's necessary to see your doctor and you haven't before seeing an acupuncturist, we would recommend that you do so. A lot of times, request blood workup, among other things, urinalysis. Let's see what's going on. Let's see the MRI reports, X-ray reports. So don't be afraid to see an acupuncturist. There's so many ways in which you can benefit. Another is swollen and sore leg or legs, which can be a sign of, let's say, cellulitis, blood clot, a serious bacterial skin infection. Call your doctor or your acupuncturist right away. Don't turn into, Bob the health or Jane the health specialist all of a sudden, where I can figure this out while perusing a pharmacy or drugstore. No, don't do that. Don't do that. Now, some can experience, again, I spoke about vomiting before, but now in this case, there's blood in your vomit. We have problems. See, these are things you don't want to metastasize into something far greater than what it should be, that'll cost you in so many ways to address later on down the line. We're simply contacting your acupuncturist and even your doctor to address it right away. You wouldn't regret it in the long run. There's a reason why we're called Acupuncture is My Life. And this is just simply close your eyes and say to yourself, acupuncture is my life, and then open it. And see how you feel. And if you don't have a local acupuncturist near you, again, contact Acupuncture is My Life. Follow us on social media platforms, every one of them, even TikTok. There's so much information out there to your avail. It's ridiculous. Any questions, download the Acupuncture is My Life app at the Google Play Store. Go to acupunctureismylife.com. Subscribe to our weekly newsletter. We usually send out around 2 newsletters a week full of information regarding acupuncture. Loaded with information. And a lot of people contact us, oh, I didn't know this or that, and can you explain? And we sit and we talk. There's devices, there's ways in which you can contact us, and certain things that we'll explain. And some is just strongly sit with an acupuncturist, because we can't be absolute about a condition if you're not in front of us to be diagnosed. So we experience those that, unfortunately had stage 1 cancer or some type of ailment, and they expect answers in a telehealth conference or, on the Acupuncture My Life chat or email or phone or whatever. And it's basic questions we can answer via those avenues. But also keep in mind, just the same as when you go see a doctor, it's just the same as seeing an acupuncturist. You need to be there. This is why we recommend you sit with a local acupuncturist to be properly diagnosed. And any recommendations, or if it's recommended you see your doctor, I mean, we'll do that. We'll make those recommendations in a second. But keep in mind, health is wealth. That's what it's all about. And just remember, acupuncture is my life. What's yours?